19, Milli Tanner was suffering from stomach and back pains and found blood in her stool. But her symptoms were repeatedly dismissed by doctors who told her she was too young to have cancer.
So, after not 1, 2 or 3 visits, but 13 visits to a GP, Milli took matters into her own hands and ordered a bowel cancer test online. And yes, she was eventually diagnosed with stage 3 bowel cancer when she was 22 years old. Milli's now in remission, but her case has sparked calls for greater awareness of rising rates of cancer among young people. So, Milli's here alongside Rosie Vare from the Teenage Cancer Trust. And Dr. Amir joins us down the line from Yorkshire, where he's in his GP surgery. Very good morning to all of you, especially to you, Milli.
Thank you.
How frustrating and dangerous it was to be turned away from your GP, told you're too young. And what conversations were you having with the doctor about your symptoms?
When I'd first gone in, they had said that, I'd maybe overdone it on a night out, potentially irritated the stomach lining, and had basically just said, make sure to eat something before going out.
This is because you've got, let's be frank about it, you've got blood in your poo.
Yeah.
And so you say to the doctor, this, along with pain in my stomach, is... Did you have a concern at that stage about what it might be?
Not at the beginning, no. I wasn't sure what it was to begin with. Obviously, there's so many different reasons why you could be having those symptoms. So, no, at the start, I didn't think it would have been bowel cancer, but as the months and the years went on, by the time I was diagnosed, I knew exactly what it was going to be.
I just can't believe you went 13 times before you managed to get a diagnosis, and that was only because you ordered your own testing kit and then went back to them and said, look, this has been flagged up. Can I please have a bit more of an analysis of what's going on here?
Yeah, so, well, I did the test in the July, and it wasn't until the November where I got the colonoscopy to diagnose me. So even then, it still was a long wait.
Talk to us about... So you order the test. This is a private test or an NHS test that you order online?
It was a private one that I'd ordered online.
So you had to pay for it?
Yeah, which just detects blood in your stool, which I knew I already had, but...
And then you went back to the doctor and said, this is the result. What was the doctor's reaction at that point?
They had said... Well, we had a discussion about red flags and to come back if it carries on. And then eventually, a few months later, they ordered their own version of the same test, and that was what got me on the 2-week pathway for the colonoscopy. And
then you have the colonoscopy, and tell us what happened during that, because by that point you thought to yourself, didn't you, I'm pretty sure that this is what I think, the worst that I think this can be.
Yeah, well, I saw it on the screen almost straight away, the tumour.
Oh, my goodness.
And I said to the doctor, what is that? And she said, it's a tumour. And I said, is it cancer? And she said, I'm really sorry. And I can't really remember a lot else after that point until me and my partner then went into the doctor's room, spoke to the doctor, and she explained to us what it was and said that it looked like it had been there for a couple of years.
How did you feel when you got that news? Because you've said in the past you felt vindicated to some extent, that at least you've been banging on the door about the right thing, but at the same time you must have felt angry that they'd overlooked it and now you were having to face serious treatment.
Yeah, I mean, at the time, I didn't feel too angry there and then. I didn't know what the next steps were. I just felt relieved that we had finally found out what it was. It was quite painful seeing everybody else around me getting upset, and it was a big shock to them, whereas I knew what it was going to be.
I feel angry on your behalf.
Yeah.
I feel so upset. How many years down the line are you at this point?
So at the end of this month, it'll be 2 years since I was diagnosed.
But when you first went when you were 19. And then how much further down the line were you actually diagnosed with...
2.5 years after my symptoms started.
Rosie, this is absolutely shocking. You're from the Teenage Cancer Trust. So Milli was told at 19, you're worrying about nothing.
Yeah.
In fact, almost blaming her. You've had a big night out, you need to eat more, you're not looking after yourself properly.
Yeah.
So how many young people are in Milli's position?
So I think, firstly, it's really important to thank Milli for shedding a light
Totally
on this situation and sharing her story so openly as well. We're so grateful for this, and it's so important that people listen to the voices of young people with cancer. So in the UK, there's roughly 7 young people a day who are hearing the words, "you have cancer." So that's around 2,500 young people per year. And what we know from a recent NHS cancer patient experience survey is that nearly half of the young people who go on to be diagnosed with cancer are visiting their GP 3 or more times before they're diagnosed, which just shows the system isn't working for young people and something really needs to change.
Yeah, especially when cancer rates are rising in the under 50s. I just want to bring in Dr. Amir here, because, Dr. Amir, maybe we can talk about some of the symptoms here. I mean, Millie's described some of hers, but what should people be looking out for? And why are cancer rates, do you think, on the rise in under 50s? Because that's a really concerning trend.
Morning. Yeah, this is a sad case, and thank you, Millie, for talking about it. The kind of things that anyone should be looking out for when it comes to bowel cancer specifically is a change in your bowel habits, blood in your poo, any unexplained abdominal pain, weight loss, tiredness, or lumps in your tummy. In Millie's case there, as a GP, anyone under the age of 50 who comes in with any bleeding from the back passage, particularly with abdominal pain, and it's unexplained, that's the key thing. There was no other explanation here. We can't just keep passing the buck on and on. Then that does need investigating with the stool test to look for blood, and then an urgent referral if that does come back positive. In terms of what's causing a rise in bowel cancer in young people, I think it's important to say, yes, it is certainly rising, but the vast majority of bowel cancer does happen in people over the age of 50. But it's important to know why it's happening in younger people. The big thing is probably the intake of ultra-processed foods. So these are foods with very little nutrients in, but more importantly, very little fibre in. Fibre feeds our gut microbiome, our gut bacteria, which help reduce inflammation and quicken the passage of food through the gut. And if food is there for longer, any potential carcinogens are in contact with the bowel for longer as well. The other thing is processed meats, things like bacon and luncheon meats. They contain something called nitrates and nitrites that help with the preservation of those meats. They're converted to something called nitroso compounds by the gut bacteria, and that increases your risk of bowel cancer. Other things, obesity. We've seen a rise in obesity in younger people as well. This is not specific to Millie, but obesity, fat cells release hormones, growth hormones that cause cells to divide faster, increase the risk of mutations. And then we're also looking at now recent research, the use of antibiotics in young people and children unnecessarily, which can kill happy, healthy bacteria in the gut, and infections with certain strains of E. coli, which release certain toxins that can affect the gut and affect the DNA in the cells. And lastly, environmental factors like pollution as well can affect the gut. So all of those things combined are causing a rise in young people with cancer. Thank you.
Dr. Amir, thanks so much. Such useful advice. Millie, how are you doing right now?
I'm in remission. I've been cancer-free since August 2024.
Thank goodness you took matters into your own hands. I mean, thank goodness.
Yeah.
Your whole family must be very grateful. And let's hope that GPs and doctors hear your story, take it seriously, and don't dismiss young people just because it's unlikely.
Yeah.
Because in your case, you knew eventually what you had before the doctors did. Thank you both so much.
We should just say the Department of Health says it is committed to improving cancer care for patients. They go on to say there's more to be done, and they've launched the Children and Young People Cancer Task Force.
Yeah, and if you're affected by any of the issues we discussed in the programme, there's advice and support at itv.com/helplines.